So we have a team of more than 10 designers working in our country offices at iDE and other locations around the world. And as designers, we aim to utilize this methodology and the principles and values that Jess has just shared in all of our work across our WASH projects, as well as other projects as well. But as she said, really, design work is not just done by designers. It's a collaborative work that we do hand in hand, especially with WASH practitioners, but also others. And so I work in our Ethiopia office with Martha and other WASH colleagues so that we can all adapt these kind of principles, mindsets, and practical tools that we can use across our work. It's not just to be siloed within a particular individual or sector. So you can go to the next slide. So we follow basically the same process that Jess has outlined from discovery to delivery. It really is the same. This is just a different visualization with a few more steps or stages involved that she also mentioned, and a slightly different way of visualizing it, especially because we like to emphasize this kind of experimentation and the fact that in reality, it's really an iterative approach. It's quite messy. It's not an A to Z process. Oftentimes we're skipping back and forth as we're trying to learn. So in each of these stages, we are user-focused and we engage potential users of sanitation products and services in order to understand their needs, their preferences, desires, and to design solutions together. So we also engage other experts and stakeholders. So these could be like WASH technical team members, private suppliers, government actors, community leaders, and influencers, because we're not just designing and selling a single product, but we're trying to create an entire, to develop and capacitate a sanitation market. So this includes a lot of different actors, right? In which all of these actors are interacting, they're affecting the uptake of improved sanitation behaviors. So it's just an important thing to remember that this process is not just about, being a designer or only engaging the user. Of course, we want to be user-focused, but it involves a lot of different types of individuals and processes in order to fully understand and develop the kind of complex solutions that we might be working towards together. So with that, I'll hand it over to Martha to give us a more in-depth look at one of the projects that we are working on in Ethiopia PReSERVE.
Thank you, Becca. So today I'm going to share our experience using human-centered design in one of our WASH projects called Poverty Reduced Sustainably in an Environment of Resilient and Vibrant Economy, which is PReSERVE. It's an integrated activity to improve the food security of vulnerable households in targeted PSNP communities in Amhara region. So iDE's role in this PReSERVE is primarily to drive sanitation access through building market for sanitation. So we used human-centered design to deeply understand the context needed to inform the interventions that include gaining more understanding of parents, current knowledge, attitude, practice, drivers, and also communication channels in WASH behaviors to inform interventions. So HCD added value, mostly in generating customer insights, both opportunity and barrier side. And also we like prototype and testing to refine our business model, also our strategy. During the delivery phase, also we capacitated actors to engage in market-based sanitation and support with the social behavior change among customers. Next slide, please. During our research, we generated key insights from the research. One is the household would like an aspirational and affordable toilet that offers a much better value and experience than the latrine that most people know and have used in the past. When we asked about each person's ideal toilet, most people mentioned components that were durable and easy to clean. Specifically, people wanted a floor that was washable and a well-with block, a roof with iron sheet, and a concrete slab. The other finding is our findings reinforce the importance of inclusive financing for sanitation solution in these waradas, while some requires financing for toilet, but others who have already land and livestock are willing to pay in cash. But they want to pay after like harvest or sales, indicating income seasonality, relevance in cash purchase. The other finding we have is people understand the importance of sanitation, especially in community health and environmental cleanliness, such as like they providing a clean area for children to play and maintaining odor-free surrounding. So our research actually revealed like three main reason motivating customers to invest in better latrine. Such as like privacy, people don't want to be seen or feel ashamed. Safety is another issue, like people don't want to feel safe and comfortable. And also like the majority of people considering having a latrine as source of pride and dignified, which is especially for women and girls by enabling them to use facilities at any time of the day. So this is the three key motivators we found during the research. When we come to the supply chain, there is no supply chain in that particular rural area. Most people don't know where a complete toilet can be purchased. People are aware of where to buy different materials, but they don't know if or where there is a one-stop shop that sells a ready-to-be installed latrine. And with the demand creation or influencer, during the discussion with customer and stakeholder, it was like they were suggesting that influential community members and leaders, like religious leaders, can be effective by encouraging others to see the advantage of purchasing and using latrine. Next slide, please. So we prototype different products based on the knowledge we get from the discovery phase. So based on the idea generated, we prototype and testing product preference and how they would like purchase, also their willingness to pay and financing piece. We also see like the transportation and installation options for those products. We also test like message that resonate with them to develop our social behavior change communication material. So this was done through demonstration, follow-up conversation, sharing of photos, using feedback from and we collect feedback from the first round prototyping, which is a low resolution prototype. And we tested the physical prototypes to further refine products and financial model and also messaging materials. Next slide, please. We do also market segmentation. So our research find that the testing confirmed it is based to target both early adopters and early majority, because the group of early adopter is not very large. So it's worth to targeting both segments at the same time during the rollout phase. So our first target customers are like wealthy farmers who have more than 1 hectare of land and also lots of livestock, and also households who have a second income source in addition to farming. The other early adopters are model household, individual who is a model community member who have a better latrine than most in the community, and also open to new technologies. So the third are the people who have a risk-taker mindset involved in different business are the early adopters. Next slide, please. So when we come to demand creation, so iDE engage individual sales agents drawn from the community as the main promoters of the latrine products. So sales agents use side seller, which we develop based on the message we tested that resonate to the customers. So to promote sanitation products door-to-door at the marketplace and also around health post in Kabale location area. So they are supported by health extension worker who are a government staff at the grassroots level. Also, we use women development armies who are volunteers at the community level to support sales agent into demand creation. We also use a religious leader based on the finding we have in the discovery phase. There are role models in using sanitation product and also teaching the community after Sunday service, after Sunday church service. Next slide, please. So the supply chain, as I mentioned earlier, we don't find supply like a well-established supply chain in rural areas. So we establish a supply chain for sanitation product and service by building individual latrine business owners to produce sanitation product at the Kabale level for ease of transportation. So, and link them with retailers who are selling plastic sanitation products, and also link with the raw material suppliers so that latrine business owners purchase the raw material from the local markets. Next slide, please. So this is our market-based sanitation business model. We build a robust market-based sanitation business model that leverage the strengths of both private and public actors to drive sanitation and uptake. So including iDE trained sales agent and latrine producer who are drawn from the communities, as well as working with the government employed health extension workers. So iDE promotes, as I said, a direct sales strategy, creating a network of sales agents who could who promote like those products door to door and at the marketplace. This sales agent received a commission from the latrine business owner, ensuring that the sustainability of the model. So we are also working with financial institutions as finances in this a key issue in market-based sanitation. So we work with unions, microfinance institutions to avail loans for both customers and business owners. So this is our overarching market-based sanitation business model. So we adapt based on the context when we enter into the new areas.